It's the year 1992. I was 6 years old at a wedding function in Karachi. A fire broke out. Within minutes, nearly half of my body was encapsulated in third-degree burns. Yet the biggest challenge wasn't the accident itself. It was what was about to follow. Pakistan at that point in time had no proper burns institute or facilities. A simple thing or an equipment such as a skin grafting machine had to be imported before the doctors could even begin to save my life. That was my first experience with Pakistan's healthcare sector. My case may sound extraordinary, but it is very ordinary. It is the case of millions of Pakistanis that are looking for help. Here's the ground reality. Patients today visit doctors, pharmacies, and labs that don't talk to each other. They get prescriptions with little or no counseling. And they have to carry all old files of tests, labs, and prescriptions because there's no digital record. You're sick, you buy medicine, and you don't know if it's going to be able to cure you or kill you. This is the key reason why Pakistan's health outcomes are one of the lowest in the region. To make things worse, middle-class family is one chronic disease away from being pushed into poverty. A chronic disease such as diabetes can easily push anybody who's in middle class below poverty line. Our healthcare system is not broken. No, it's dangerous. The next slide is a little graphic. So viewer discretion is advised. So if you have a faint heart, then please look away. That's me. 2017. No, I'm not taking selfies for myself. I'm sending picture to my surgeon to see if my wounds have healed, so he can take the sutures out. How things have changed from 92 to 2018, where I don't need to pay a visit to a doctor just so that he could check. This is still 8 years ago. No one prepares you for how long a burns treatment will last. And for that matter, how expensive that will be. No one tells you that. It essentially mimics a chronic disease, a long-term disease that needs to be managed and taken care of. After 3 decades of being in and out of hospitals and carrying and living with my scars, I know this. Our healthcare system was not designed to save lives. No. It was designed to leave people behind. Change slides. Poverty in this country unfortunately kills you before disease does, and that is a reality, and a reality for millions of Pakistani. So when I had the chance to build something, I asked myself a very personal question. What if no mother, no child, or no family had to wait for help the way I once did? That question became Meri Pharmacy. The vision is clear. We're here to simplify healthcare and healthcare for Pakistan. And how do we do it? By reimagining pharmacy not just as a store that sells pills. Hum khali dawaiyan nahi bechte. But reimagining it as the first step to your healthcare journey. How we started off was very simple and very clear. It was a simple store where people could walk in, call, or simply place an order through an app and get medicines. Over time, we added counseling as a key parameter to our service delivery mix. Now, counseling today is a cornerstone of a service delivery model. Fast forward to today, we moved beyond medicines. Through a partner network and affiliate network today, we do health camps at our locations that focus on preventive healthcare and disease management. Our aim is to make sure people don't come to us for our medicines. They come to us to get counseled so that they don't have to buy medicines and manage the disease in a better way. Right? Digital records of prescriptions, that is something that we thrive upon. We have every single prescription that we've catered from inception to this date. At the very least, we can safely say that you don't need to carry your prescription records if you come to one of my stores and you've had an experience with our stores, right? So in short, what started as a basic pharmacy is now converted into a one-stop healthcare shop. We started very basic. Over the years, everybody wanted to come and work with us. And by doing that and by working with others, we've now become into a healthcare hub. In the last 4 years, we built a network of 26 odd pharmacies across the city. We've served close to 2.5 million patients. Today, we serve 2 patients every single minute. Our hospital-based pharmacies operate around the clock, 365 days. While you sleep, we are still up working for you without fail. But the real impact isn't in numbers. No. The real impact is in a mother knowing that she doesn't have to choose between food and medicine. The real impact is in a father who knows the medicine that he buys for his kids is real. The real impact is in a child who doesn't have to wait for a simple machine to come in from abroad to save his life. So what I've learned is this. Healthcare transformation doesn't have to start with billion-dollar hospitals. No, it doesn't. It doesn't even have to start with high-tech machines. It starts with the simple and the most basic unit of healthcare, that is a trusted pharmacy. Let's start there. By providing authentic medicines, accessible medicines, we save lives. You change futures when you do that. Every day I carry my scars. They remind me of pain. Yes, they do. But more importantly, they remind me of possibility. They remind me of a possibility because the systems we inherit are not permanent. They're challenges. Challenges are meant to be changed. This is not just my story. This is Pakistan's story. And together, we can build and simplify healthcare for Pakistan. Thank you, everyone.